if you have an aesthetic concern that you're trying to fix, you need to look deeper into why that aesthetic issue is bothering you. Okay, so sometimes people come into the office, they have acne, they have pigmentation issues, they have areas that they want to fix. Maybe they're seeing signs of aging and all of that. And there's nothing wrong with wanting to fix what you see on the outside, but you have to explore the deeper meaning behind what could be going on. Okay, so I saw a patient today who was complaining about having nasolabial folds and just generally looking tired, and wanted to know what she could do for anti-aging, right? And she also had a little bit of fat underneath her neck that she wanted to improve. So she wanted to know what can she do anti-aging wise to improve the look. And I talked to her a little bit, and I was trying to figure out, what was going on, like why was this bothering her so much. And so before we even got to the bottom line of what was going on, she told me she had gone to 4 different practitioners. Everybody had told her different things, and nobody was giving her definitive answers as to what needed to be fixed or what she could do. Now, I was looking at her and I was just like, my goodness, you're so beautiful. Like, she's a gorgeous woman. And I was like, I see the thing that is bothering her, but overall, when I look at her overall picture and her face, I thought she was gorgeous. And I didn't think that she necessarily needed to be focusing on those things. Granted, what I see and what she sees are 2 different things. So I asked her, like, what is the thing that's bothering you? And so she told me the nasolabial folds were bothering her. Her under eye bags were bothering her. She could see signs that she's aging. And when digging a little bit deeper, it turns out that she's also working on losing weight. And so that she has a lot of things going on. And so the things that were of concern for her, I said, we really shouldn't try to address those things right now. And the reason is, when I've looked at everything that you're going through, the weight loss seems to be the thing that will impact your face the most. And so it's really important to focus on one thing. In this situation, it would be her focusing on losing weight, because we're not going to know how her face is going to look after she's lost weight. She might lose the fat underneath her chin. She may not. We don't know that. She might have more volume loss in her face. She may not. Her nasolabial folds may get worse. And so treating her right now for something that could get worse later didn't make any sense. So I told her, I was like, you need to focus on one thing right now. And the deeper issue was that she didn't want to work on the things that she didn't want to work on the deeper issues that revolve around her weight, right? So for her, it felt like if she fixed her under eyes, and if she fixed her nasolabial folds, and she removed the fat underneath her chin, then she's doing something to prevent aging. And I was like, the thing that you need to do to prevent aging is you need to sleep. And I knew she wasn't sleeping, because I just knew, you could tell. I was like, you need to get better sleep. I was like, you need to get more rest. I was like, you need to eat healthy. I was like, you're on medication for weight loss, but are you eating healthy? Are you moving your body? Sometimes people will use weight loss medication as a way to avoid the work that needs to be done. And don't get me wrong, there is a role for weight loss medication. But if you take the medication and you don't do the things that are necessary for you to lose weight, it's kind of pointless, right? You cannot just expect a medication to do everything for you. 80% of all the things that we need to do has to do with weight loss, has to do with our diet, right? And our exercise. Like, that's 80%. And so the medication is only there to help with 20% of the issues that you're dealing with. So I had a little heart-to-heart with her. I was like, we can't do anything right now. It would not be a good service to treat you for signs of aging, because weight loss might age you further, and you may not be happy with the results. And it would feel like a waste of money. I wouldn't feel comfortable injecting somebody who could potentially have worsening symptoms. After the weight loss, she might actually look better. Her facial structure might look more defined, and she wouldn't need the things that she's looking for. And so I was like, at this moment right now, you have too many goals. You have too many things that you're trying to fix. And you need to focus on fixing one thing. And fixing that one thing has the potential to fix so many other things, right? Losing weight in this situation could help her have a more chiseled jawline, could help her reduce the fat underneath her chin. It also may not, right? And so we don't know that until we reach our goal, which is her health goal. And so I was like, in the meantime, instead of putting all your energy into all the little things that you can visibly see that you want to fix, put that energy internally. Take that energy and ask yourself, am I getting enough sleep? What am I doing at night? Why am I probably doom scrolling on social media? Because I know people are like that. Why am I not sleeping? What am I avoiding? Like, what are the issues that I'm dealing with internally that subconsciously I'm not dealing with? And so then I might be using things like food to cope, or using things like social media to cope, or using skincare to cope, or using aesthetic procedures to cope. Like, so many times people are dealing with internal struggles, and instead of working on facing them and working through them, they would rather kind of outsource the problem, right? And so they would look to do things outside of themselves in hopes that it will fix the inside. But it doesn't work that way. You always have to fix the internal in order for the external to look better or to be better. So I'm an internist by education, so I will always advocate for internal health, because once you're healthy internally, you can see the effects on your skin. If you're healthy internally, you have less acne, you won't have facial hair, you won't gain weight, right? You won't have dull skin. Like, you will look really good if 80% of you internally is healthy. And so always focus on the inside, because if your entire goal is on things that are outside of you, things that are visible, you're chasing the 20% instead of chasing the 80%. And to become a whole person, I believe that 80% of that requires you to work internally, and then 20% of that requires you to work externally. And so if you flip it, then you're going to feel empty inside, because now 80% of your energy is going towards something that's outside, and 20% is not enough, right? If you think about a phone, if your phone is at 20% or lower, then it's red. So you're depleted because you haven't focused on replenishing what's inside, or fixing or healing some of the issues that you might be dealing with. So this comes up a lot in aesthetics, because people want to fix what they see. And again, I get it. Nobody wants to walk around with a certain thing that's bothering them. But I will always say this: fix what's going on inside. Work on the inside, okay? Make sure you're eating healthy foods. Make sure you're moving your body. Make sure that you're working on your mental health. Make sure that you're getting enough sleep. Are you hydrating? Put down the phone, okay? Stop doom scrolling on social media, because that is depleting your brain. It's taking away energy from your brain. Do the things that are going to help you internally. Fill your cup up to 80%, and then look for the outside to give you the 20%, okay? So this is just something, I'm literally in scrubs. I just left the office, and it was just in my heart to bring this up, because I hope it helps somebody out there. But we need to work a lot more on our internal health, and we need to work more on our mental health and all of that, and dealing with our traumas and dealing with all of that, everything, right? And in a way, society doesn't want us to do that, because I live in America, and here things are just go, 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 and chaos. And so when you live in a chaotic state, you don't even have time to sit still to figure out what's going on with you internally. You're so focused on what's going on externally and on the outside. And that is not going to serve you in any way. And that is going to lead to a lot of issues, a lot of disease. And so the goal is always going to be to focus on the inside. Focus on replenishing yourself. Fill your cup up to 80%. And then you can get the 20% from outside if you want to. Or you could fill your cup up with up to 100, and then everything on the outside is like the icing to the cake, right? So speaking of the cake analogy, your goal is to build the cake, right? There's no point in chasing the icing. and there's no cake to put it on. So as a matter of fact, icing tastes disgusting if you just eat it without the cake, right? So you have to focus on building the cake, making sure that the recipe is good, is like, you know, all the moving parts are okay, bake it and it's a good cake. Then you can say, all right, I want some icing, right? And so that maybe that's where the skincare comes in. Maybe the Botox and fillers or whatever, it's just icing on the cake, right? Whatever else we're doing in the office, let that be the icing, but don't make the icing the cake, because that's not what it is. All right, I'm done with my rant for today. I hope this video helps somebody, and I'll be back at some point talking about another topic. So if you like this video, let me know. If you don't like it, let me know. Doesn't matter. I'm just posting my thoughts. But I'll see you on the next video. Bye.